today's webinar, Claims Are from Mars, Attachments Are from Venus. Thank you for joining us. Before we get started, I have a few administrative details to go over. As you noticed upon joining the webinar, everyone has been placed on mute for the presentation. At the end of the presentation, there will be a Q&A session. So in your GoToMeeting control panel, you'll see a questions box. Please type your questions or comments into the field and hit enter. Please note that the recording of this webinar, along with the slide deck, will be posted to the WEDI website, and downloading instructions will be emailed to all registrants following the live webinar. I'd like to introduce our speakers for today's webinar. We have John Kelly, Principal Business Advisor at Edifecs, and he's also a WEDI board member. He's a nationally recognized health information exchange expert. He provides strategic consulting to Edifecs customers, specializing in information exchange and applying the principles of supply chain integration to the healthcare delivery lifecycle. His wide-ranging experience includes serving as CIO of healthcare network provider Navinet, Director of E-Business Architecture at Harvard Pilgrim Healthcare, and Managing Director of Zone Health IT Consulting Firm. Kelly also served as the architect and technical lead for the Commonwealth of Massachusetts' statewide HIE project. He currently serves on the board of directors for WEDI as well as the Massachusetts Health Data Consortium. Sergio, the Senior Director of Product Management, brings more than a decade's expertise in healthcare and integration experience in both product management and engineering. He is the Senior Director of Product Management at Edifecs and is responsible for product management and strategy for transaction management product. He holds a master's degree in computer science as well as pragmatic marketing certification and product management. Without any further ado, I'd like to go ahead and hand it over to John.
Hi, thank you everybody for attending today. We're going to cover the topic that it seems to be on everybody's mind today about claims attachments and how that integrates with operations at health plans and payers. Briefly, to go over what we'll discuss today, talk a little bit about the problem, and then go through kind of the 5 salient points that we think everybody should be thinking about if they're going to move forward with a claims attachment solution. First, we'll cover what we're calling the multi-channel conundrum, talk a little bit about automating back-end integration, what your strategy needs to be for what we call a channel strategy to make sure you're hitting an entire network of providers, and then talk a little bit about what are the optimal technology approaches that you should be using, and then a fifth important thing, making sure you're getting the ROI from your investment. So next slide. So claims are from Mars, attachments of Venus. What are we trying to talk about here? And I think, we're talking about trying to create a union, a happy union of two processes that have evolved very independently on both the payer and the provider side. The claims process has been independent in terms of systems and people, and then attachments, kind of evolved as an afterthought process that's done mostly in a lot of separate parts of an organization. Where they evolved around paper, mail systems, manual requests for additional information. And what has happened, I think, is that we've been rushing toward trying to put solutions in place to automate processes without spending enough time thinking about the fact that this really, in order to be successful, is about creating a happy union between two completely separate silos in the organizations. Next slide. So why don't we advance one more? So we'll start with, what's the problem? And I think, to a lot of people, the problem is very familiar. Identifying and routing the request, identifying what you need extra information for, who you need it from, and how do you communicate that to them. And then the issue of you get, in many cases, paper and images coming in, they have to be matched to the correct claims so that you can actually make a decision on a pending claim about whether it should be paid or denied. And then, storing, receiving, sharing the attached data, moving it around, these are all done in a lot of siloed systems. So, this has been historically a problem that we see in a lot of our customers. And then there's a slow transition from image-based attachments to structured data. The promise of all the EMR investment over the last 10 to 12 years, hundreds of millions of dollars in most cases, has been about creating structured data, but being able to actually make use of that data, work it into our everyday business processes has been a challenge for everybody. And then also, I think, kind of insufficient or excessive and wrong information received from providers. A lot of payers that we hear, they send out for more information, and what they get back is basically a dump. If it's a PDF, it's could be as many as 200 or 300 pages sometimes. If it's a structured document like HL7 CCDA, frequently what happens is you have the equivalent of 300 pages of just a few bits of information scattered here and there. And you add to that the idea that with all the people who've been trying to solve the attachment problem over the last number of years, we have as many as 5,000 different document types that have been designed by the standards bodies, but all really about trying to get procedure notes, op notes, discharge summaries, progress notes, as you can see, the various basic information that people need to acquire in order to get the claims. And then add to that the fact that we're using predominantly fax, postal services, and phone to get this information in. Next slide. I got it. So, cost of attachments. One of the things that I think, these are numbers from CAQH Index, and these numbers have varied quite a bit over the last number of years. They've gone up, they've gone down. Last year, a lot of the numbers were showing that provider attachments, the providers were paying a lot more for the attachment process than payers. This year's results have indicating that it's very close in terms of the cost to both sides. I think this reflects the fact that we're just getting better at trying to understand where the costs are. But in general, when you do anecdotal, you have anecdotal conversations with the payers or providers, and they talk about all the stuff that doesn't get counted, the amount of money we're paying per attachments on both sides is probably significantly higher than what's being currently reported. Next slide. So what we've come up with is what we call 5 critical steps to achieve this happy union of these two processes. In a sense, the marriage of Venus and Mars, to push our metaphor a little. So we'll start with talking about what we call the multi-channel conundrum, automating back-end integration, reaching all providers, optimizing technology, and then guaranteeing the ROI through data reuse. Next slide. So conquering the multi-channel conundrum. Want to advance one more? So what we mean by the multi-channel conundrum is, under a manual system, it's kind of straightforward. You send out letters, you get back paper, it gets imaged and comes in. But when you start to try to automate and you have claims coming in, claims coming in through the clearinghouse, attachments coming in through a portal, or attachments coming in paper, claim coming in paper with a paper attachment, or claim coming in paper and electronic attachment coming through a portal. You have this situation where you have stuff coming in from multiple places, and it's really a situation when you add clearinghouses on top of that. If so many different channels, pieces of information are coming in, that you have a situation where, we like to talk to our customers about, you're putting Humpty Dumpty back together again. It's a huge challenge, and when we see the attempts at creating solutions for this, we see kind of people who are trying to automate process, but there's never a big picture look at this. And what we do is we end up with what we call this multi-channel conundrum, where you have different documents that take time and energy to put back together. And sometimes it can take not just days, but sometimes weeks to be able to create a situation where you're putting the right information with the right claim in front of the right person to be able to actually make a pay or deny decision. Next slide. So Sergio, do you want to talk a little bit about how we see the problem of the multi-channel conundrum should be solved?
Sure, John. So thank you, John. So as John mentioned, the biggest problem is how do we correlate all these different types of documents? How do we make sure there is no orphans, that all these different documents, they progress through the internal systems smoothly? So we believe the solution to that, the payers need to have a unified intake mechanism where every single document is accounted for. And then that unified intake mechanism can not only track each and every document, but then they can add the smartness to correlate these documents. And let me give an example. If a claim comes in electronically and the claim indicates that there is an attachment, expect an attachment to come over, maybe the system may also just hold that claim for a set period of time and wait until the attachment comes over, correlates the two, make sure that everything is fine, everything is prepared for, and then after that maybe release it. So then when the claims adjuster goes and looks at that claim, I mean, he has already all the information, and from one side, from the other side, nothing is lost and everything is accounted for. So having one unified channel, one way how consistently to submit this information, track it, and coordinate, orchestrate this whole flow, we believe is the ultimately is what would solve the problem related to multi-channel conundrum. Thank you. Go to the next slide. So please advance.
Sorry, I was on mute. The next issue that the point that we think people need to be thinking about is automating the back-end integration. So, you know, first on the conundrum, get command of the information coming in and out. Second, once it gets inside, we see that what's emerging, because these processes are in different places, the solutions you have a lot of times implemented people who have implemented solutions that are one solution for the automated or digital claims attachments and still a separate solution for the paper, so that you have the processors either organized in business units or whatever, but they're basically doing what we call swivel chair integration. They have an attachment, but based on, they can't make their decision, or the way they have to make their decisions, they're looking in one screen or one portal for the paper stuff, and then looking at another screen or another portal for the electronic stuff. And a lot of times, because the image or the supporting documentation is coming in also through multiple channels, sometimes there's even a third or a fifth system that gets pulled into play, that people have to do this swivel chair integration to go back and forth from system to system to make decisions. So this is a major issue. I think that, you know, as much advancement has been made, this is where kind of the rubber meets the road, in the sense of bringing together the Venus and the Mars process silos and getting them so that the claims processor, who's got a job to do, which is to look at documentation and make a decision, that they shouldn't be put in the situation of having to have one process and go back and forth between the paper side of the house, the image side of the house, and a separate process and a separate set of tools to use to deal with electronic attachments. To the processor, they shouldn't care, and in reality, they probably shouldn't even know whether or not the supporting documentation came in electronically or on paper. Next slide. Sergey, you want to talk about what that flow looks like?
Sure. So typically what we've seen by talking to various pair customers is the paper attachments, they all ultimately get stored in some imaging system. And today, already there is internal set processes where the adjusters, they look maybe at the claim in their backend adjudication system, and maybe they pull the imaging system to look at for and inspect, review the supporting documentation. So when you add to this the electronic attachments, of course you want to with the least disruption to kind of continue the same process, at least for now, while the paper is still out there. So new ways how people can submit attachments, what we're seeing is, of course, there is prevalence of portals out there. There is some people have started adopting the 277, 275 transactions, and this could come in either directly from the providers or maybe through some even clearing houses. Some clearing houses have upped the ante, and they've added support for generating those transactions. And if you think about it, all these different flows of electronic transactions, you need to have a unified EDI gateway. And this EDI gateway not only should be able to kind of take in, parse these transactions, of course, validate, make sure that everything is correct, but moreover, it needs to be able to take that electronic attachment and place it right back into the imaging system. So from the end user, end claim adjuster perspective, he shouldn't really care whether the attachment came in electronically or it came in on paper. He just needs to continue to use the same process as before. If you think about the promises of the electronic attachments, now that we have structured, not only unstructured, but also structured information, the payers need to think about also be able to integrate this with maybe third-party utilization management systems, so to be able to kind of take more advance of these electronic transactions. And even paper ones, I mean, there is systems out there that can take it, scan the image, extract keywords, and using some kind of latest algorithms, they can make it from unstructured to somewhat structured information. So there is definitely interest out there to extract more value of these transactions. So I need to integrate all these different transactions with the various backend systems is a must, we believe. So at the very least, integrating with the legacy imaging system, so the flows continues to work as it is, and also they need to integrate with newer systems such as utilization management, population health, and so on, value-based care supporting systems. It's a must nowadays. Next slide.
Yes, so Sergey, just maybe one last point. I think the key thing that we're trying to get across there is that since the payer systems are not ready to take structured information and automate the process of the claims processor right now, it's still a human process. The idea is even if things come in digitally, the primary process for making decisions is still human. So get the digital image over to get the digital document, the CCD, the ADT, the HL7 document that's structured and formalized, and push it over to as an image into the system, so that as far as the claims process is concerned, they don't know, did it come in paper, did it come in electronic, didn't matter. As far as they're concerned, they see a picture in front of them and a claim in front of them, and they can make their decision. So the third point that we want to make sure is that you put a system in place that actually can help you reach all of the providers in the network. Next slide. So, we kind of roll this up into a simple thing. You have providers that have no tech, low tech, and high tech. And the issue is that, if they have no tech at all, you've got to be able to get to them. If they're still working on paper charts and faxes and email systems, then, and I apologize for the background noise, I'm in a suboptimal location based on some travel, but hope you can bear with me. And that they implement, at least have a portal that the payer providers can go nowhere else, come to the payer portal and leverage that. A lot of providers, though, do have at least portal access through clearinghouses or through their vendor, and they have some capabilities. So being able to create a capability on the payer side that can talk to many channels, that is based on standards 275, 277, 837 integration, so that they can connect to the provider at whatever tool they're using. And then, of course, having a platform that can fully automate the X12 transactions, can then do direct connections directly to EHRs, revenue cycle systems, and clearinghouses, so that you really have a true end-to-end automated integration. Next slide. So we talked about kind of the approaches, the getting to all your providers, the back-end integration, and looking at how you're approaching the information coming in the multi-channel conundrum. Now we're going to talk a little bit about what's the kind of technology picture, that footprint that you need to support those approaches. Next slide. So let's talk about what you see right now in the manual process. It's really two separate, generally silos in an organization for unsolicited and solicited claims. The classic unsolicited claim is the surgical note that providers know that they're not going to get their claim paid if it's a surgical procedure unless they provide a note. So they do the EDI, but then separately they send in paper. Or they say, you know what, all of my surgical claims, I'm just going to dump to paper. And then it comes either to postal service, a fax, or sometimes a portal, and then it goes into the claims system and then the imaging workflow. If you think about the solicited, the only difference really functionally is that there's a front-end process where a claim comes in, and then the payer makes a decision that they need more information, and then they communicate that somehow out, whether it's a letter, whether it's a phone call or an email, or whether it's 276, 277, but then really the back end of the process looks exactly the same. So the idea, if we can go to the next slide, is that if you're going to try to automate this and take care of the orphan data that's coming in through multiple channels, kind of think about what Sergio had said about the two approaches originally. First get control of all of the data coming in, and then second, have a way to integrate into the back end in your systems so that you have a single platform, a single approach to deal whether it's solicited or unsolicited. Next slide. So this is kind of getting back to the original image we had of these two siloed processes. What we're trying to pitch here, whether it's the technology infrastructure or whether it's the approach for back-end integration or the multi-channel conundrum, you have a challenge that you've got these two different silos, and there has to be some kind of an integration layer that you create within your organization. It's a combination of business process and technology so that you integrate those processes so that they don't look like two separate silos. Now we're in a transition period, as we go forward, as we get familiar, as there are attachments rules that come out and other rules for requests for additional information addressing PA and other things, this will become more standardized. The technology systems, whether it's the EMR, the RCM, or the payer claim systems, will have a lot of this stuff built in because the workflow's been defined and the business processes have been matured. But right now, it really takes building an integration layer between the two sides of the house to get the kind of results that people are looking to get. So Sergio, do you want to pick up a little bit more and talk at a deeper level about the technology infrastructure that's required here?
Sure. Thank you, John. So if you look at the left-hand side, let's talk about the claims workflow a little bit. So traditionally, when the claim comes in and then the claim adjusts look at it, or maybe in automated fashion, the claim gets pended. So the system will normally generate some kind of a trigger that I need additional information. And usually this trigger is somehow routed to a paper process where maybe a letter is being printed and sent out to the provider, or maybe a phone call or a fax being sent. So there is this kind of manual, semi-costly process gets triggered in. And if you look at the attachments workflow on the right-hand side, in electronic world, what the industry is gravitating towards is the use of 277 to 75 transactions. So how do you bridge these two worlds together? How do you enable the left-hand side, the legacy adjudication systems to speak now electronic attachments and understand those? That's why you need this layer in the middle, that will kind of make this happy union of these two worlds. You need this layer in the middle to be able to understand the trigger from the backend and automatically translate that into a standards-based 277 request for information transaction, which will be sent out to the provider. Of course, for those that maybe are less sophisticated or don't support this, it may be still routed to some kind of provider portal, or maybe they're routed to the clearinghouse that are more sophisticated, so then they can help their provider base. But the thing is, this middle layer kind of bridges the two worlds by being able to take the legacy messages and translating them into now new electronic 277 requests for information being sent out. And then if the 275 transactions that embodies the attachment comes in, this middle layer here now can take that transaction, extract it, parse it, take the relevant documents, and then store them in the back into the legacy system. So from claim workflow perspective, everything is shielded. Everything continues to work the same as it worked before, but suddenly the payer now is doing not on paper, but is doing on electronic, and everything is, he's reaping the benefits of that by lowering the cost. Can you go to the next slide? Now, in the future state, what we foresee is that maybe you have heard the advent of newer technologies such as FHIR, If you think about fire and fire resources, the industry is kind of moving in that direction. That's kind of more in the future state, but there's definitely interest. So that's another alternative mechanism how attachments can be requested and provisioned to the backend system. So instead of maybe doing the 277 to 75 transactions, a fire request to a fire resource can be made, connect to that fire server, extract the relevant information based on the original trigger message from the backend, intelligently translate it into a fire request, get those fire resources and map it back into either an image or some other format that is understood by the backend. So here on this slide, you can see that it's really at play all the notions that we were talking before. It's the deep backend integration, but also the move to the electronic transactions, electronic formats. And if you think about also this middle layer insulates the backend from all these different trends that we see in the, so either it's a 277, 275, or if it's a fire, the backend really doesn't change in this picture. It's still the same if need to be. Of course, over time, if we get to all electronic, then backend probably will need to change to take advantage of the structured information to really automate the manual process that the claim adjusters are doing. Can you go to the next slide?
And I think, Sergio, one of the things that is important about what you just said there is that this approach means that whatever you invest in that middle layer, that the connection, the happy union between Venus and Mars, it's future compatible for a significant amount of time, even if the work with fire and other electronic standards matures and goes forward, you still get to reap the benefits in a throwaway investment.
Yeah, thank you, John. Can you just build out the slide? So the point of this slide is trying to say that there is all these different communications now and channels going on. We kind of, on this slide, we wanted to put all the previous points kind of on all slides. So here you can see this conundrum of multiple channels coming in from the provider. So there is the clearinghouse network on the bottom, which is maybe sending 37s. Hopefully in the future, the 277 to 75 transactions. Some providers probably will require less sophisticated ones. They will require some, maybe as a mid or as a workaround, some kind of portal solution. And the portal then will need to be able to translate to the provider in a business-friendly speak the 277 request, what is exactly asked for them, and when they upload attachments, they provision those attachments, the portal should be able to go back and generate the 275 transactions. So, and on the back end, on the payer side, the EDI gateway should be able to just seamlessly process all these different transaction types, regardless of the channel, and should be able to then deeply integrate with the backend systems that we talked before. So on this slide, you can see, I mean, just this sheer complexity. So to be able to tackle all this complexity, really you need one is the unified gateway that is able to take in all these different transaction types seamlessly and shield all other kind of backend systems, sit there in the front to be able to process these transactions and correlate all these transactions, make sure that they monitor the lifecycle of these transactions, and coordinate the this workflow of all the different transactions. And to be able to cater to less sophisticated users, the solution should also be either integrate with or at the very minimum also provide a provider-facing portal. So at least for the providers that are less sophisticated, that don't understand this, the newer transactions, but still to get away from paper, is to give them a means to electronically get the request for information and also ability to submit those attachments. So in a kind of a more graphical portal type solution. But behind the scene, the portal should still generate those the same 277 to 75 transactions. Next slide.
So here's another really critical point, being able to guarantee your ROI through data reuse. As we saw, earlier, just some quick numbers on the return on investment. Being able to get more out of that investment beyond just solving the attachments problem is really key here. Next slide. So if you look at the numbers from CIQH, a little more detail here. The primary takeaway is, a lot of healthcare is trying to save trillions of dollars. And if you think about the kind of money per se that's involved here, you get an ROI, but it's, it's not blowing anybody away with the numbers. Want to go to the next slide? So we've done some ROI use cases with a couple of customers. One a large national payer. They're doing about 3.5 million attachment claims per year. And if you look at the kind of savings we're able to see by a payer adopting that, $400,000 in a year. Now, for a large payer, that's not a lot of money. And if you look at over 5 years, $11 million is a lot of money, but when you think about a lot of payers, even a small payer is $1 billion company. The point we're trying to say is that you don't look at attachments just in terms of a huge savings, but you look at attachments in terms of, will the investment I make cover the cost of automating a process? So, that's when you start to think about, well, what else can I get if I automate the attachments piece? Next slide. So the key thing is that if you think about, you're getting structured data in to support specifically attachment, well, it's structured data. It can be parsed, and then it can be used, and it can be pushed into your data warehouse. It can be pushed into your clinical systems. So you get that extra bump from the fact that you're bringing in an HL7 CCD or an ADT or some set of messages from providers that are structured. Well, guess what? That's just all gravy that you can take that and push it to some other process in the organization. It doesn't go away. A picture, PDF, sits in an imaging system. You've got to use NLP on it. You've got to do a whole lot to get extra information out of it. But if you move to a structured attachments for those providers in your network that can send you, parsed data, now you've got an extra bump, so that maybe $300,000 the first year on just the attachment savings might not mean a lot to the the operating budget, but it might mean a whole lot to the medical director if he's getting a lot more clinical information that he didn't have before or she didn't have. The other thing is increased patient satisfaction. When you can smooth the attachment process and workflow and automate it, there are people, I've encountered cases, you have patients who are cancer patients, and they have huge claims, and if they're held up for weeks or months, sometimes they're getting notices from providers that they owe $30,000 or $40,000 or $60,000. Well, it'd be awful nice to be able to make that go away by just automating the information, so that claims adjuster can make a quick decision in a matter of days, not weeks and months. And then I think the last thing is that the same infrastructure, if you think about attachments in general, it's a request for additional information. And if you think about chart polls, prior authorization, appeals, they're all generally requests for additional information. So if you can automate the other triggers beside appended claim for payment to other triggers in the organization, that I need charts pulled to support my risk adjustment and risk selection and risk calculations, or I need additional information for prior authorization, or I want to reprocess my appeals. The same infrastructure that supports the RFAI for attachments and claims can easily be reused to support these other use cases. Next slide. So just on the chart review, we've seen a lot of interest. We talked to a lot of folks about attachments for a couple of years now. Suddenly there's a huge interest with this idea that they can be used for chart pulls. And just, a typical chart pull can run anywhere from basically $30 to $290 when a payer needs to reach out to a provider to get more information to look at, to support Medicare and Medicaid premiums, or to support HEDIS and STARS measures. And these are just the numbers from the payer side. This doesn't count for the wasted time and the inefficiency on the provider side when they've got to actually go through paper charts or manually print off records off of an EMR. Next slide. So in conclusion, want to go to the next slide? I think, getting back to those 5 critical steps, step 1 is really about whatever whichever solutions you pick, whatever vendor you're working with, whatever approach you take, you're not going to get a lot of yield unless you conquer the chaos in the front end. Organize the information, make sure you've got control over all of the channels coming in. Step number 2, get your back end integrated. Make sure that your structured data is being converted to images so that your claims processes only have one way to deal with these problems. Make sure you're reaching all of your providers. Optimize your technology infrastructure, and make sure you're getting a guaranteed ROI through data reuse. Next slide. So this is, this isn't meant to say we're great or we're brilliant or anything. All this is meant to tell you is that the information we're presenting to you comes from a very large footprint of payer customers, provider customers, and folks who are informing us in terms of these 5 critical steps that you need to adopt. Next slide. So with that, I think we can open the floor to Q&A. Any questions from anybody? Thank you very much for your time.
Thanks, John and Sergio. Got a few questions already, but for everybody else on the webinar, please make sure you type your questions into the questions box, hit enter, and we will get them answered. So the first question, how can we ensure successful provider adoption for low-tech physician offices?
That's a great question, and I think it's, there's a lot of questions where, answers may or may not be straightforward. What we know from statistics that have been published by lots of different people, clearinghouse associations, ONC, research that's been done by CAQH, is that on the property and casualty side, there are tens of millions of attachments going on every year through portal solutions and other solutions. There are many, I think there are 11 or 12 states now that mandate that all workers' comp requests for additional RFIs be automated. What that means is that in all of your networks out there, you have patients that are walking into a doctor's office with, say, a broken leg. If they broke their leg at work, the attachment's coming in electronically. If they broke their leg at home, the attachment's coming in manually. So the idea that there's already a base of tens of millions of attachments happening every day based on property and casualty and workers' comp claims, that if you implement a solution that can deal with the 275, 277 transaction and deal with attachments that way, you can go into your network and you're going to find, hundreds of thousands of providers in the country who are already using the solution for other lines of business. And so you can actually look at the tax IDs that are being submitted to some of these workers' comp companies, and you can immediately see that all of those claims that are currently being done manually in your organization for those tax IDs would on day one be able to convert over with their existing technology on their desktop to be able to submit electronic attachments. Another question, Sam?
Yep. What are your thoughts on proposed upcoming mandates around attachments?
Well, a crystal ball with this administration is a tough thing to do. It had been published at the beginning of the year that there was a schedule to release an attachments rule by August. Current information that we have from CMS is that it will be this year, but maybe not till December. So I think there's two things going on. One is we continue to hear that HHS feels that they've killed other rules, but that this one's actually a business-friendly rule. Standardizing attachments saves people money, which bodes well for a rule coming out of the current political climate. The second thing is the industry seems to be moving forward regardless of whether a rule comes out or not. WEDI actually is organizing next week an attachments and a PA forum, spending 2 full days with the folks from the feds and other organizations around the country to talk about attachments, how they need to be done, what the current state of affairs is, how the transactions can be implemented. And everything we're seeing certainly is that people are moving ahead even without an attachments rule.
Thanks, John. Next question, How long should we expect an attachment management solution implementation to take?
Sergio, do you want to take that one since you're more involved in the technology and implementation side of the house?
Sure. So we've already engaged with a number of customers implementing the attachment solutions as we speak. The biggest, I would say the biggest, but one big part of the implementation, where time is spent is actually going through the requirements. The thing is, customers already have provider portals. They require integrations. They don't have the capabilities to upload attachments. So this again, talking about the reaching out to various providers, especially the non-tech ones. So enabling the capability in their provider portal to upload these attachments is kind of one big obstacle that they're trying to overcome. So that's kind of one place where we spend time, because we have to go through kind of what the technology they use, how do we integrate single sign-on. We already have a solution for the provider-facing portal, but kind of this is the area that where we need to spend time to understand their environment and to be able to properly integrate, so then from a provider perspective, it's all seamless, nice, flowing solution. From the other side, the other kind of, I would say, bigger amount of time where things are spent is really on enabling the transaction support. This is actually for the customers that already have our smart trading solution. It's actually not a big of a lift. I would say maybe kind of 1 or 2 months worth of work, including the requirements, all the way from requirements to testing and production. It's for the customers that don't have our smart trading solution, it's a little bit more harder, because we need to then look at what the internal systems are, how do we integrate with those systems, how do we insulate, how do we introduce our solution. But the good news is for the customers that already are on our smart trading solution, it's that kind of actually is much reduced time.
Sergio, another question on the data flow side. As a payer, we do not receive information directly from providers. The slide shows the API for FHIR directly connected to the provider and payer. Could the picture be drawn with the clearinghouses residing in the middle?
Certainly. I think, the evolution of the clearinghouses, or a lot of value-added vendors now, is really to almost like the beginning of HIPAA, when people didn't have HIPAA capabilities, that the value that was provided by the third parties was to provide endpoint capability on either side, either the payers or providers. So, I mean, certainly the state of maturity is all over the map. And so I think probably for the next 3 to 5 years, we're going to see a lot of places where clearinghouses, where, individual vendors, portal vendors, there's going to be a lot of people who are adding value by enabling the endpoints to come up to the capability to start to leverage the flows that we're talking about. I guess the best way I could carry it, there are many, all roads lead to Rome, and there are many roads to Rome. And however, Sergio kind of alluded to the idea that, how long does it take to implement? Well, it depends on where you are. If you've got nothing, then, there's a lot of work there, in which case you might be engaging multiple people trying to help you get to where you want to get to. If you've already got a fairly sophisticated EMR, you've got a fairly sophisticated claim system, and you've got a lot of workflows and a enterprise services bus, and you've got all kinds of capabilities to organize your data and integrate into your back-end systems, then there's not a lot of lift. You may not need a lot of third parties, but certainly the state of the industry right now is that anyone who can add value by enabling capability to deal with standards-based data exchange, I think there's plenty of work for them to do.
Thanks, John. Another question. Can you break down what factors fed into the ROI you report?
Yeah, so the one that we did with a customer that I showed that data, looked at, if you look closely, the slide wasn't up a lot, so if you didn't see, the actual cost of the processing of the claim did not add up fully to the ROI. So that payer did take into account, the idea of reduced phone calls, of the costs of some of the processing capabilities. It did not. It still assumed that it was a manual process on the back end, that you still had an image and a claim pop up in a workflow tool, that you had a processor manually saying yes, pay or deny. It didn't go to the point that if people are looking at solutions that are being fielded by, folks like MCG and Interqual or Milliman and Interqual, where potentially payers could automate even that processor part if it's all structured information, didn't take account into that level of ROI. But basically, it was the cost of scanning, the cost of integration, the cost of the time value of all of the manual work that goes into putting Humpty Dumpty back together again.
John, and to add to in that ROI study, also what we observe specific for that customer is they've seen for those attachments sent on paper, they also seen that an uptick in claims being submitted on paper, which by reducing the paper attachments, they also reducing the paper claims, and that also contributed to that ROI number.
Yeah, that's very important. Thank you, Sergio. Especially, if you think about the OpNote situation, the idea that the providers are dropping, if they're going to send in a paper attachment, then they're going to send in a paper claim too, and that was a significant piece of volume. Yeah, thank you.
All right, that's the last question that we have. Is there anything else you'd like to leave our attendees with, Sergio or John?
Well, I think with my Weedy hat on, with my Edifecs hat on, with a lot of hats on, I would say, if you still could come to the summer forum, if it's still possible for you to drop in for 1 or 2 days, please be aware that next week Weedy will be doing this forum in Chicago, and that there's going to be a really great agenda. A number of folks from ONC and CMS are going to be there. We're hoping to get more information about, so what's the probability we're going to get that December implementation of the attachments rule. And I think there'll be a lot of people from all sides of the industry, the clearinghouse, the vendors, the payers, the providers, all sitting there basically hoping to learn from each other. So I think this is a topic that is going to be very important and a lot of work being done by Weedy in the summer forum, but it's going to carry on. I know that from the work that we're doing at Weedy, that will be, this will also be a major topic come the fall forum as well. And just make a pitch that, a lot of people are so interested in this that, we're getting some really good feedback specifically from HHS and attendance by the government and the rulemaking bodies, HL7, Weedy, X12, all of those folks are all getting together, and a lot of good talk happens at these meetings. So just to put that pitch out there for Weedy, please, if you haven't been to a Weedy forum or a Weedy conference, the feedback that we generally get is that they're very informative, very helpful, and there's a lot of ROI on attending.
And if you have any questions about how you can register, feel free to email me, sholvey@weedy.org. I'm more than happy to help everybody out. But I definitely want to thank John and Sergio for joining us for today's webinar and putting together such a fantastic presentation. Thanks to the entire team at Edifecs. This has been fantastic. And I will be emailing the slide deck along with the link to the recorded webinar to all of the registrants following just in a few minutes, actually. Thank you, everybody, for joining us today. If you have any additional questions or comments or anything, feel free to send them to me, sholvey@weedy.org, and I'll make sure that the Edifecs team gets them. Thank you again, and enjoy the rest of your week.